Hello, everyone. My name is Pharmacist Michael, and I'm here to give you all the tips you need for living a happy, healthy life. Today, we're diving into a topic that's been on the radar for many men, especially those concerned with hair loss and prostate health. Dutasteride. We'll be covering what it is, how it works, its benefits, side effects, and if it's right for you. So let's jump in. So, what exactly is dutasteride? Well, dutasteride, also known by the brand name Avodart, is a medication primarily used to treat benign prostatic hyperplasia, or BPH, which is basically an enlarged prostate. It's also being increasingly used for male pattern baldness or androgenic alopecia, which affects a lot of men as they get older. Dutasteride belongs to a class of medications called 5-alpha reductase inhibitors. It works by blocking an enzyme that converts testosterone into dihydrotestosterone, or DHT. DHT is the hormone responsible for both prostate enlargement and hair loss. Now, let's talk about the two main uses of dutasteride: treating benign prostate hyperplasia and male pattern hair loss. Both of these conditions have something in common. They are strongly influenced by DHT, and that's where dutasteride comes in. So, first of all, what is BPH? It's non-cancerous enlargement of the prostate that commonly occurs in men as they age. As the prostate gets bigger, it can start to press against the urethra, causing urinary problems like difficulty starting urination, a weak stream, or the feeling that you need to go to the bathroom urgently or frequently, especially at night. Dutasteride works by blocking the conversion of testosterone to DHT, which is the hormone that makes the prostate grow. Over time, reducing DHT levels helps to shrink the prostate, making it easier to urinate and relieving those annoying urinary symptoms. Most men start to see improvement after about 3 months of treatment, but it can take up to 6 months for the full effect. In addition to improving symptoms, dutasteride can also reduce the need for surgery in men with severe BPH. This is a big deal because surgery for BPH can come with risks like bleeding and complications. By managing the prostate size early, you might avoid that altogether. Now, it's important to know that dutasteride is often combined with another medication called tamsulosin. This combination therapy is very common for men with more severe symptoms or large prostates. Now, let's move on to hair loss, or more specifically, androgenic alopecia, also known as male pattern baldness. This condition affects millions of men, often starting in their 20s or 30s, and can lead to thinning hair and bald spots, particularly on the crown of the head. Just like with BPH, DHT is the main culprit in hair loss. High levels of DHT cause the hair follicles to shrink, leading to thinner, weaker hair, and eventually stopping hair growth altogether. By blocking the conversion of testosterone into DHT, dutasteride helps preserve hair follicles and can even stimulate hair regrowth. Now, unlike finasteride, which is FDA approved for hair loss, dutasteride is often used off-label for this purpose. However, studies have shown that dutasteride can be more effective than finasteride at reducing DHT levels and promoting hair growth. In fact, some studies suggest that dutasteride reduces DHT by up to 90%, compared to around 70% for finasteride. So if you've tried finasteride and didn't get the results you wanted, dutasteride might be a better option. Results from using dutasteride for hair loss are usually noticeable after about 6 months. But again, patience is key because hair growth is a slow process. It's also worth noting that just like with BPH, stopping dutasteride will cause DHT levels to rise again, and any hair you've regrown will likely be lost within a year. Taking dutasteride is pretty simple. It's usually taken as a 0.5 milligram capsule once daily, with or without food. Remember, it can take about 3 to 6 months to start seeing results, whether it's for prostate health or hair growth. So patience is key here. One thing to note, you shouldn't crush or chew the capsule. It needs to be swallowed whole. Of course, like any medication, dutasteride comes with its own set of potential side effects. These are usually mild, but it's important to know what to expect. Some men may experience a lower sex drive or difficulty with erections. These side effects happen in a small percentage of users, but can be bothersome if they occur. Another less common but possible side effect is reduced semen volume or problems with ejaculation. Dutasteride has been linked to tenderness or swelling in the breast area in some men. If you notice any lumps or changes, it's important to speak with your doctor. Though rare, allergic reactions like skin rashes or swelling of the lips, tongue, or face can occur. Seek medical attention immediately if this happens. While these side effects can be concerning, it's important to remember that they're not very common, and for many men, the benefits of dutasteride outweigh the risks. Let's talk about drug interactions and who should avoid dutasteride. First, drug interactions. Dutasteride can interact with other medications, including certain blood pressure drugs and antifungals like ketoconazole. Always check with your pharmacist or doctor if you're taking other prescriptions. Next, this medication should never be handled by women who are pregnant or could become pregnant. Dutasteride can be absorbed through the skin and could cause serious birth defects if a pregnant woman is exposed. So, handle with care. Additionally, if you have severe liver disease, your doctor may recommend avoiding dutasteride or closely monitoring your liver function while using it. If you're thinking about using dutasteride for the long term, here's what you need to know. Studies suggest that dutasteride is safe for long-term use, particularly for men with BPH. In fact, long-term use can continue to shrink the prostate and reduce symptoms. For hair loss, long-term use can help maintain any hair you've regrown, but stopping the medication may result in losing those gains within about a year. One more thing. If you're getting a PSA test, which is a prostate-specific antigen, to screen for prostate cancer, dutasteride can lower your PSA levels. Be sure to tell your doctor, because they might need to adjust the way they interpret your results. So, is dutasteride the right medication for you? Well, it depends. If you're dealing with bothersome symptoms from an enlarged prostate or struggling with hair loss, it could be a great option. But it's always a good idea to talk to your healthcare provider before starting any new medication, especially one with hormonal effects like dutasteride. If you found this video helpful, make sure to give it a thumbs up and don't forget to subscribe to stay updated on all things health and wellness. As always, I'm here to help you live a healthier, happier life. See you next time. My name is Pharmacist Michael. Be happy and be healthy.